So one of the things that frustrates me about big data or data in general is you've got one pharmaceutical company who has a ton of data on a subject. You've got another that has a ton of data. They're different data, but no one shares it. And if we could get to a position, I realize this is a capitalistic society, where we could share this big data, maybe we innovate faster. What do you think, Dr. Albert, some of the potentials for sharing big data and working together? Is that just pie in the sky? Is that never going to happen? And if it does, how can we do that and still remain, true to our capitalistic roots?
Well, Kevin, when they say it's not about the money, it's all about
always
the money.
About the money.
And so well, first of all, in the last 15 years, hospitals were essentially forced by the federal government to implement electronic medical records. Before that, if anybody remembers the storage rooms that looked like something out of Raiders of the Lost Ark that went on forever with paper charts and carts, before that, nobody wanted to do it. For the expense, for the problems, for the decrease in productivity, the things that actually happened. What we're going to learn is that we are collecting a lot of data, but we're not using that data. You hardly ever see anybody using it. So unless the federal government, the NIH, the Veterans Administration begins to push people, companies see it in their best interest to not share data. So unless there is a reason, and a forced reason, I think it will be hard for pharmaceutical A company to work with pharmaceutical B, or medical device A company to work with medical device B company, because everyone is always, my company included, looking for an advantage.
I agree with you. Go ahead, I'm sorry.
Completely agree with Dave. And I think that's going to be what ultimately shifts the environment in health tech, is just like the federal government mandated EHRs, now the mandates will come for interoperability, opening APIs, HL7s. I mean, the only reason we're seeing these things happen is because the federal mandates continue. And I think that that is unfortunately the only way that this will happen, because there's just no reason for all of the different stakeholders in the sandbox to play together.
I lived that reality in electrocardiography. A company had basically a monopoly position in managing EKGs in major hospitals. And until the government basically said every EKG will be in this format, DICOM, an open imaging format standard, they had you, basically, you had to buy the razor blades, the EKG machines, from them, because they had sold you the razor, and only their razor blades would fit into their razor. And so that's changed, and it was the government that forced that change. And that upset their business model a little bit.
I think that we can also leverage professional organizations. And one example is American College of Cardiology. I sit on a committee there where we have actually really begun a push for open access to data. In other words, if a company wants to come in and do a study that is going to be adjudicated or sponsored or facilitated by the ACC, that data is going to be open to everyone. So I think we as physicians, as entrepreneurs, as healthcare advocates, as experts in this field, we have to advocate for this open data. We certainly need regulatory advocates on Capitol Hill. And I think ultimately maybe we'll get there. I do share Dr. Albert's concern that we're not going to get there easily. But I want to bring us back
Can I jump in and interrupt a little? Because we have government, hospitals, and physicians. And I would expect that of the three of you as being part of that club. But Dave, in that big chart room 20 years ago, and I remember it really well, was the notion of someone taking their own EKG on the radar? Not really. And I think you know better than anyone that today a patient can take their own EKG. And the nature of data ownership might fundamentally change such that the consumer may have a role in data sharing.
I agree.
So
No
I think that's a
question about
real
it.
interesting wrinkle now that I own my data and that I may be the arbiter of sharing, not the government or not Big Pharma. So I think it's kind of an interesting dynamic as we move in that direction.
You're absolutely right. And that's, hospitals are still today arguing that they own the patient's record. And, they charge large fees to copy each page of a record or print out each page so you can take it. They can't just go send. And that's obviously an impediment. So I think what we're going to find out is it's going to be a consortium, maybe not an official one, of patients, the government, organizations like the American College of Cardiology or the American Heart Association who sponsor and finance research, that all of them will get together and you know, probably with the federal government as a motivator, help provide open data.
If oil is found on my property, I can lease the land. I can sell that oil. And I am the creator of data. So perhaps data should be considered property and consider it in that context of almost a legal discussion. So I think sharing is going to become very, very interesting. And the reality is it might become more complex on the short term because these issues will emerge.
Well, data is important, and I think it is property today. It's certainly
I think it's always been property.
It's intellectual property, and it's very valuable. And so that is, we're back to the money.
Well, and the consumer is really the only stakeholder in the system that has a reason to share, right? And particularly when I'm a mom, I have a 6-year-old. Moms who have kids at the pediatrician, let me tell you, they got all the information. They got the vaccine history, we got the medication history, we've got it all. So there's no one that has a better stake in the game to share the data. They just need the tools to get it, right? Whether it's the portal, whether it's any number of systems out there that help us from a patient engagement standpoint.
And I know, Kevin, you're trying to get in here, but you know, the lead may not be taken by healthcare. You know, we're looking at transportation, at purchasing, at so many elements of our lives as consumers that those data sets now are becoming extraordinarily valuable. So I think we may take a nod or a lead from some other industries that start managing data in new ways. So, you know, Picasso said, good artists borrow and great artists steal. Maybe it's time for healthcare to kind of look outside to fintech and retail as ways of managing data and
I think most of this is going to be driven by the patients. I very much appreciate the comment that you made, because I think that for 10 years there have been patients out there or more that have demanded their data from Medtronic, from their ICDs, or from their pacemakers. And we are still in this paternalistic society within healthcare, and particularly the healthcare-related industries, where we know better than you do, poor little patient. And that's not the case. And we must empower patients to use and to access and to own their own data, because they do. And I have fought that fight many, many days, many, many nights. And I think these patients deserve their own data, and they deserve the fruits of the labor that come from this data.